Hi, thanks for joining me again. I'd like to continue our discussion about the brain, the gut, and the immune system. And recall in the last vlog, we talked about the connection between the brain, the gut, and the immune system, and initiated that discussion, and spoke about that research at University of Virginia, which started to really say there was a hardwire connection and a discovery between this meningeal system of the brain and the gut. So we talked about that, and it's exciting that we can actually see there's some anatomical direct link, as many researchers over time really begin to intuit, and doctors, even nutritionalists. Now, as well, we talked about the leaky gut syndrome, the idea that food, which should be contained within the immune system, sometimes there's pores and holes that puncture the gut and the intestines and allows food products to overflow into the body cavity. And I spoke of how the immune system draws its resources into the absorption of the food, which lowers immune system function. And that's why a lot of people that have leaky gut syndrome inadvertently may discover they have memory problems. And also they have more allergies because the immune system's resources is drawn away from defending us from pollens and other foreign invaders. And they can develop a whole laundry list of other symptoms, which otherwise seems rather puzzling. So we spoke about that. And one of the things that I want to touch on today is a little bit more about how the body insulates itself and how the immune system protects itself and what happens when it doesn't. So we have that traditional mucosal lining, which keeps food contained within a proper area. However, sometimes there's a compromise of that area between inflammation, between even genetically engineered products, so that gut level gets punctured. There's another innermost lining that's more recently been defined as the gut or the enteric level, the gut enteric level. And enteric deals with the gut, but it also deals with these cells also found in the immune system called glial cells. And it really belies and reflects there's a communication neuronally between the gut and the brain itself. Now, one of the things I want to describe, which really takes a bit to really understand how things accumulate towards the perfect storm, in this case, not a great storm, is that, for example, as some of you have heard the story, I met with a gentleman on the Southern California Alzheimer's Association about 40 years ago, about 10 years ago, sorry. Seems like about 40 years ago sometimes. And basically he said to me, he said, you know, Mike, about 40% of people in an Alzheimer's unit have diabetes, which was new information for me at the time. So I started to look more closely between this initial connection between the gut and the brain. And what I found is that when there is inflammation in the body born of diabetes, one of the things we talk about is blood glucose level and insulin resistance. What happens in the body is when there's insulin resistance, it means the body isn't able to utilize the glucose in the body more easily. Glucose fuels the body. It's the energy that allows us to function and work better. But there's also in the brain the ability of the brain to absorb glucose as well. And unfortunately, or not, about 60% of all the glucose in the body is absorbed by the brain. So, at least in certain cases, if there's insulin resistance in the brain, it's as if the brain is drowning in a sea of plenty. It's not able to absorb the glucose, which gives its energy to function. So hopefully that makes sense. Now, what happens in the triple storm or the perfect storm is things pile high and deeper, unfortunately, on one another. So you have one factor, which there's insulin resistance. The gut is intimately involved in that. And in some cases, fortunately not all, that insulin resistance in the body is reflected in the brain. So the brain has less resources to use. It has less energy to convert. Then, as well, because you have inflammation born of the diabetes, for example, there's inflammatory processes in the body which also can overflow into the brain. And as I mentioned in previous blogs about the lymphatic system, how the lymphatic system reacts to inflammation to defend itself is these billions of tendrils in the glial cells deep inside the brain, which form billions of channels for the circulation of cerebrospinal fluid and extracellular fluid. They swell up and they become tighter, and the effect is that there's less flow of cerebrospinal fluid. So you have inflammation in the brain, you have less utilization of glucose and energy, and then the coup de grace is that also because of aging and other factors, when there's less flow of cerebrospinal fluid, either born of inflammatory process from digestion or otherwise, you have the opportunistic occurrence of these amyloid plaques and neurofibrillary tangles basically accumulating in the brain. And over a long period of time, this typically doesn't happen all at once. It can take decades to occur. As we found in our research with Alzheimer's dementia. This may be accumulating for 10, 20, or 30 years, from our 30s and 40s. Finally, the brain just can't handle it anymore. There's too much inflammation. There's too much of degradation in flow of cerebrospinal fluid. There's not enough glucose being absorbed by the brain. And so with these three things happening, brain inflammation, lack of utilization of cerebrospinal fluid, and also diminishing of cerebrospinal fluid, and lacking of, utilization of the glucose and energy, you have the perfect opportunity for mental dysfunction to occur. If you take a look at David Perlmutter's book on grain brain, he looks at these derivatives from a slightly different angle, but talks about this as well. So certainly I'm not the only one beginning to talk about this, but I'm also correlating this with brain function, lymphatic system, and cranial psychotherapy as well. So that's an example of what some of the negative consequences of digestion and immune system are. Because the immune system develops an inflammatory response, and when we have these foreign invaders, again, it draws that resource of the immune system away from protecting us from really legitimate foreign invaders. So the immune system is really diverted, if it will. And unfortunately for a lot of the population, especially 100 million people that are diabetic or pre-diabetic in the United States, that's about a third of the population. This is a growing threat. So when you look at connecting the dots, you can see how the brain, the gut, and the immune system occur. Now, again, the good news about cranial psychotherapy is it offers some hope in this area. One of the things that we can do in treating with cranial psychotherapy, I mentioned how people get a more recuperative sleep in another blog. Well, also what happens is very common when you're treating people with cranial psychotherapy, you'll hear their stomach start to rumble. You'll actually feel their digestive system relax. And that paresthesis, that digestive, the borborygmus we call about it, the tummy rumbling, begins to increase. And there's more relaxation in the digestive tract. This is a good thing, because what we found a lot with seniors that have memory problems is that they're also constipated. And, you know, sometimes seniors joke about a good day of having a bowel movement, that's a good day. And we see that in babies. You know, babies eat, sleep, and poop. And when they can't poop, sorry to bring it that way, but they're not happy. Well, it's the same as we get older. If we're not passing things through and utilizing things well, that's a problem. So cranial psychotherapy seems to help with constipation, relaxing things, getting things moving more freely. And imagine what would happen if there's a compromise to the gut and the system over time isn't able to utilize nutrients more effectively. When you have constipation, that even exacerbates all these other problems that I mentioned in terms of lack of flow of cerebrospinal fluid, inflammation, and lack of utilization of that energy from the glucose being absorbed by the brain. Cranial psychotherapy seems to be helping relax connective tissue and also lower sympathetic tone and aid in that way. So you can imagine if the GI tract is friendly through that neuronal pathway of this brain and gut enteric barrier, and things are moving more easily, things are going to be easier all the way along. So as we get older, and this is simply not just for those of us that are over 65, but as we get older and the gut can function more easily, it really reflects beneficially in the brain as well. So just sharing, and hopefully in these last few blogs, kind of connecting the dots between the anatomy of the lymphatic system, and its effect on sleep, and its effect on the digestive system and the immune system as well. So I look forward to sharing some other insights with you as we move into the fall. And thanks again for watching, and enjoy your summer.